Hello everyone. Today we will discuss a very interesting topic in the field of psycholinguistics. Within the field of psycholinguistics, we have a sub-branch that is known as neurolinguistics. So today's topic is relevant with the sub-branch of psycholinguistics, that is neurolinguistics. So we will discuss in detail the relationship between language and mind. What are the different parts of the brain which are responsible for speech production and speech comprehension? So we will discuss these all different parts of the brain which are responsible for language processes. Let's discuss and learn in detail. Introduction to neurolinguistics. So what is neurolinguistics? Neurolinguistics is the study of how the brain processes language. This is one definition, right? Okay, it deals, with the study of how the brain processes language. The second one, it examines how language is produced, understood, and stored in the mind. This is also neurolinguistics does. Third, neurolinguistics studies brain regions responsible for speech and comprehension. And the fourth one, that neurolinguistics explores language disorder caused by brain injuries. So these are all the areas which the neurolinguistics deal with, right? It studies that how language processes in the mind. It studies that how language is produced, understood, and stored in the mind. It studies what are the regions responsible for speech production and speech comprehension. It studies the different disorder caused by brain injuries, right? So this is what neurolinguistic deals with. Now this is brain, right? You can see different parts of the brain which are responsible. Here you can see Broca's area. We will discuss this in detail, production of speech. And here you can see that auditory association area. And here you can see that auditory cortex. Here you can see that Wernicke's area, that is for speech comprehension. Here you can see visual cortex, right? And so on, right? So we will discuss these different parts on coming slides. The first one, brain area involved in language processing. So what are the area? The first area which is involved in language processing, that is known as Broca's area. So this is Broca's area, which is responsible for speech production. If you are unable to produce correct sentences, right, you have some disability. So it might be that due to the stroke, or it might be due to some injuries, this part is injured of your brain. That's why that you cannot produce sentences perfectly, correctly. So you have problem with your speech. So Broca's area located in the left frontal lobe, and it controlled speech production, right? Let me repeat again. If you have a problem in speech production, so this part of your brain might be injured due to several reasons, right? It might be due to stroke, right? It might be due to some other accident, but this part of your brain is injured. That's why you have problem with speech production, right? So the first part, that is Broca's area. Examples in sentences. If we have, we are talking about Broca's area, we have some example, speaking example. When Hera says, I am going to the market. So her Broca's area helps her form and speak the sentences smoothly, right? So this is that if you cannot produce sentences smoothly, so you have problem with this Broca's area. And if your Broca's area, it functions properly, so you will be able to produce correct sentences. The way Hira is making proper and correct sentences. I'm going to the market, right? So her Broca's area helps her to form and speak sentences smoothly. Answering a question. The teacher asked Bilal a question, and his Broca's area helps him put his thought into words and answer clearly. Excuse me. Again, so Broca's area is responsible if someone asks you a question and you answer and using words. Giving a presentation. While presenting in class, Ali's Broca's area allowing him to speak confidently and fluently. Again, that is with speech production. If you speak confidently and fluently, so your Broca's area, that is because of your Broca's area. And strugglings with speech if damage. If Broca's area, that is damage, issue, then you will have problem. You will struggle with your speech. If someone has damage to Broca's area, so they may know what they want to say, but can only speak in short, broken phrases like go, stow, now. So they may know the sentences, they may know the language, as we mentioned here. They may know what they want to say. They have in their mind that I want to say this. Okay? But what is the problem? Because this Broca area is damaged, that's why they will produce short phrases and words. Like they will say, go, stow, now. They won't produce like complete sentences, right? So issue with the Broca's area. Now, brain area involves in language processing. We have another area that is known as Wernicke's area. So Wernicke's area found in the left temporal lobe responsible for comprehension. This is Wernicke's area. So you might be able to produce sentences. Your Broca's area might be fine. But if this part is damaged, so you will have problem in comprehension. Right? You have problem in understanding what someone else is saying. Okay, so this is another area which is responsible for speech understanding. Okay, not production, but for comprehension. We have some examples here. Listening to someone talk. Wernicke's area help you understand what they are saying. If you're talking someone and you listen them, right, and you understand them, so your Wernicke's area is responsible for that, right? And reading a newspaper, it helps you grasp the meaning of the text. You understand? If you can understand the meaning of the text of the newspaper of a book, so that is because of your Wernicke's area, it works, it functions properly. If there's problem with your Wernicke's area, so you might not understand, okay, what when you read something or when somebody says something, so you will not comprehend it. So watching a movie, it helps you follow the dialogue because your Wernicke's area, it functions properly. Wernicke's area example is sentences. For example, listening example. When Ali here, his teacher says, please open your book. His Wernicke's area help him understand what she means. And you open the book because you understand. And your Wernicke's area helps you. Reading example. Sarah reads the sentences, the sun rises in the east, and her Wernicke's area helps her understand the meaning of the words. Again, here is understanding and comprehension. If you read something or somebody says something and you understand, you comprehend, so your Wernicke's area functions properly. If you can't, so your Wernicke's area, it doesn't function properly. Conversation example. During a phone call, Ahmad listens carefully to his friend's story. His Wernicke's area allow him to follow the conversations and respond correctly. An example from movie. While watching an English movie, Aisha understands the dialogue easily because her Wernicke's area processes the language. And if your Wernicke's area, this part of your brain is damaged, then you won't comprehend. If you read something or someone says something to you, you will have issue in this all if your Wernicke's area is damaged. Now, brain area involved in language processing, we have another one that is called angular gyrus. Angular gyrus. Angular gyrus plays a role in reading and writing. So this is another part of your brain which is involved if you read something and you write something. If this part is working properly, you will be able to read, you will be able to write. And if this angular gyrus, this part of your brain which is here, angular gyrus, if this part is damaged, so you will have issues and problem in reading and writing. You can see this temporal lobe and this is frontal lobe, and here we have angular gyrus. Fine. So this is okay area which is responsible for reading and writing. Examples: reading a book. The angular gyrus helps you turn the written words into meaning, and you read something and you turn these words into meaning. Writing an essay, it helps you organize your thoughts into written language. And reading a sentence aloud, it connects what you see with how you say it. So this is also important area in your brain. Brain areas involved in language processing. So we have another area that is known as primary auditory cortex. You can see here primary auditory cortex. It receives signals from the ear via auditory nerves. It receives signal from the ears, right, through auditory nerve. It analyzes basic feature of sound like pitch, high or low sound, volume, loud or soft, rhythm, tone. Then this information is passed to other area of the brain for more complex processing like understanding and speech, music. Right, so this is okay where something begins. If this part is damaged, okay, so then your further parts of the brain will not function to understand and to produce speech. Examples: your ear catch the sound. That signal travels through the nerves to the primary auditory cortex, and this area helps you recognize the sound as a voice and its basic features. Other brain organs help you understand what was said and who said it. So in order to comprehend something, okay, for comprehension, this part is also very much important, because here the waves enter in your through your ears to your mind. Right? Somebody says something through your ear, it enters in the mind, and then from the mind it travels to other parts of the brain to produce something or to comprehend something. Examples: damage to the Broca's area lead to difficulty in forming sentences. If this part of your brain is damaged, you will have problems in what? Difficulties in what? Forming sentences. This is called Broca's area. A Broca's area is damaged due to stroke or due to some injuries. You will have problem in forming sentences. Okay? You can see here Wernicke's model here, that primary motor cortex is here, and here we have acute facialis, and here we have Broca's area, here we have primary auditory cortex, here we have angular gyrus, primary visual cortex, and Wernicke's area. This is Wernicke's area. Quick fact about Broca's aphasia. Now, what is Broca's aphasia? Located in the motor cortex of the left hemisphere and critical for language production and speaking and writing. That's Broca's area. So Broca's aphasia occurs when there is damage to Broca's area. So when there is damage to Broca's area, so you will have Broca's aphasia, often due to a stroke or traumatic brain injury. So non-fluent speech, you will be non-fluent in speech because use of short sentences can be hard to think of words and difficulty with grammar. And strengthening in comprehension, typically easier to understand, speech, typically easier to understand speech than produce. So you will understand the speech, but you will be unable to produce, because the problem that is in Broca's area, Broca's aphasia, the problem is not Wernicke's aphasia. How the brain processes language. Hearing words, the auditory cortex process sound, as we talked about. Here we have auditory cortex. We talked about here primary auditory cortex. So it says that hearing words, the auditory cortex processes sound, and then we have understanding, meaning, Wernicke's area deciphers meanings. So then Wernicke's area is responsible because once the sounds hear through the ear. And then producing speech, Broca's areas organize speech production. If you want to say something, then Broca's area is responsible for that. And reading and writing, so then we have visual cortex, and angulus gyrus helps decode symbols. This part is responsible to decode, to read and write something. Language disorder, aphasia. Aphasia, a language disorder caused by brain damage, often due to stroke. The three main types of aphasia. One is called Broca's aphasia, one is called Wernicke's aphasia, and one is called Global's aphasia. So the three main types of aphasia which involve trouble speaking, writing, or understanding language includes, these are the three types of aphasia. Problems. If these are damaged, you will have problems. Now, aphasia happens when a part of the brain associated with language, like the frontal lobe, the temporal lobe, or the parietal lobe, is damaged. So, and one of the part is damaged, so then you will have problem in understanding and production, okay, or listening or something. So it is most common after a stroke, but it can also be caused by a traumatic brain injury, a brain tumor, or infections of the brain. Less common types of aphasia also exist. Less common types of aphasia also exist. Now you can see here, if you have problem with aphasia, you're suffering from aphasia, so you will have trouble in speaking clearly. This will be what type of aphasia? Broca's aphasia. Trouble speaking clearly. Trouble understanding speech, you will have Wernicke's aphasia. Trouble writing, you will have angulus gyrus aphasia. And trouble understanding writing words, again the same one. And trouble remembering words, and similarly troubling remembering object names. Symptoms of aphasia. If you have suffering from aphasia, so the symptoms can be that trouble speaking clearly, trouble understanding speech, trouble writing clearly, and trouble understanding written words, and trouble remembering words, and trouble remembering object names. Aphasia, you can see here different types of aphasia, and difficulty speaking, difficulty writing, difficulty reading, and difficulty understanding. Now the first one, that is Broca's aphasia. Broca's aphasia, difficulty speaking, but comprehension remains intact. Comprehension is fine. If this part is damaged, Broca's, so comprehension will be fine. You will have problem in speaking. For example, you can understand, or you want to say that I want an apple. You have this in mind, but you can't say it. You can't produce. You will say a apple. So you'll have problem to produce sentences. You will use some phrases, okay, broken words, not complete one. Now Wernicke's aphasia, fluent. You will be able to speak fluently, but nonsensical speech with poor comprehensions. But you will not understand. You will have problem with understanding. For example, I want an apple. You will be able to say this, but you will can't understand. You won't comprehend. marble, ya, bean, I, him, right? You will say something nonsensical that won't be understandable for you, right? Global aphasia. You probably can say, I want an apple, okay? But marble is I read or uh, graphatic. So global aphasia, severe impairments in both speaking and understanding. So global aphasia, when you have issues and problem with both, right? In speaking also and understanding also. You want an apple, you can't say it. You want an apple, you can't comprehend if somebody says something to you. So global aphasia consists of both these issues, Broca's and Wernicke's. Example that a stroke patient struggles to form sentences but understand them. Now foreign accent syndrome, that is called FAS, F-A-S, a rare disorder where individuals develop a foreign sounding accent. A rare disorder, often occurs after brain injury, strokes, or neurological condition. So you adopt a foreign accent because of this stroke. Speech patterns change due to alterations in motor controls. Example that a British woman starts speaking with a French-like accent after a stroke. You will adopt a foreign accent because of this stroke. Case studies in neurolinguistics. So, Finis gauge brain injury affected decision making and speech. And Sarah Scott, a teenager with Broca's aphasia, recognized speech ability. Right? And foreign accent syndromes cases, multiple documented cases worldwide. And stroke survivors' language rehabilitation studies show brain plasticity. Now, brain plasticity and language recovery. You can recover if you're suffering from Broca's or Wernicke's damage or problems issue in early age. So the brain can recognize and comprehend for damaged areas. Speech therapy and cognitive exercise help language recovery. Younger brain recover faster due to the higher plasticity. Example that a stroke patients regain speech through therapy or neutral adaptation. Conclusion: language processing is a complex function involving multiple brain regions. Neurolinguistics help us understand speech disorders and their treatment. Ongoing research explores brain plasticity and AI applications in speech recovery. So this is okay. Conclusion: this was a comprehensive lecture on the relationship between language and brain, and what are the parts which are responsible for language production, language comprehension, and further we talked about how we remember words. We talked about that how auditory cortex involves in the start when the sounds enter in your ear and then enter in your mind. If you have any questions, so please feel free and ask your question in comment section. So in next lecture we will discuss some more interesting lecture that will be relevant to psycholinguistics or sociolinguistics or forensic linguistics. Thank you so much.